Our next presentation is from Professor Jeremy Hughes, Kidney Research UK Chairman. Now, Jeremy is going to give us an update on the latest COVID-19 research, future research, and how he wants to raise £3 million. Jeremy.
Great, thank you very much indeed, Pete. Thanks very much for the invitation to speak to you today at this meeting, and I'm delighted to be joining you from Edinburgh, which is not very sunny, I'm afraid. And I hope the technology is going to work for me. It's working, fantastic. So first, although many of you will actually know us well, I wanted to say a few words about the charity and give you a flavour as to the kinds of things that we do. So we fund research in all areas of kidney disease. Transplantation is one example, in children and in adults. And the funding that we provide to junior clinicians or PhD students, that actually helps to increase research capacity, both now and in the future in the UK. We fund research projects, but we also do big things by working with industry. For example, we funded a large clinical trial, like the pivotal study, which looked at iron therapy in dialysis patients. It recruited thousands of patients. And also we fund large programs of research. So again, Peter mentioned £3 million. We recently funded a £3 million Make Every Kidney Count campaign. And that was to fund research aiming at making kidney transplants last longer. The charity can take on big infrastructure projects, and they're actually very important in research. So we worked with multiple industrial companies and the academic community to establish the Nurture Biobank. And that has samples from 3,000 patients who have renal disease and 800 patients who have nephrotic syndrome. And this resource will power research in the future to answer many research questions. And then more recently, we've been quite busy virtually developing some additional national networks, such as medical technology, a data network, and also a dialysis research network. And the aim of these is to bring people together from across the UK to try and catalyze research in these different areas. And I want to give you a brief update because of time on the charity and COVID research and what this might mean for patients. So despite the dreadful impact of COVID-19 on our income, so it hit our income by about 40%, and sadly that meant redundancies, furlough, and a reduction in hours for many of our staff. Despite that, we were being approached directly to be involved in research projects. And one of these is the Protect V study. And essentially, the charity worked with a group of funders, shown on this slide, that came together to fund the project. And this study is now going well. It's recruited hundreds of patients across the UK, and it will determine whether the nasal administration, like a hay fever spray, of a drug called niclosamide, and this drug is previously normally used to treat tapeworm infections, but it is active against the COVID virus. And we want to know whether taking this drug nasally can either prevent COVID-19 or limit the severity of the illness in patients who are vulnerable and high risk. And that obviously is our population of kidney patients, because they're immunosuppressed and may respond less well to the vaccine. So we hope that if successful, this trial is going to add another layer of potential protection for kidney patients, both now and in the future. And I would add actually that this trial has now gone international to India, and we would all have seen the awful situation that was in India recently with COVID. So again, it may, if successful with a positive result, it may be important internationally. So we were then asked to fund a vaccine efficacy project by helping to build a COVID research fund. We went to Andrea at the NKF, and she very kindly put us in contact with the various kidney patient associations. And we were really delighted, actually, that some of you were able to respond. And as a group of funders shown on this slide, it enabled the project to go ahead. And this vaccine efficacy project mentioned by Andrea in her talk earlier in this meeting will focus upon dialysis patients, because dialysis patients are at increased risk of developing severe COVID, and also they have to attend hospital to receive their treatment. Oh, let me go back. So this research, as Andrea said, is going to examine 1,200 hemodialysis patients from across the UK. It's going to look at the immune response to the vaccine, both before they get the first dose and after the first and second dose, and actually after 6 months and 12 months. And the idea is to understand how do patients respond over time to the vaccination. And that data is really vital, because if you don't understand that, the pattern of immunity in a vulnerable patient group, you don't really understand exactly who may be at increased risk despite having the vaccination. And this study is good because it's a big study, and a big study with hundreds of patients can actually look at different factors that may affect the response to the vaccine. So, for example, age, the type of vaccine, as you mentioned, the mRNA versus the Oxford vaccine, ethnic background, and also accompanying health conditions such as diabetes, because that all can impact upon how a patient may respond to a vaccine. Now, at the moment, we are currently working together with 4 other non-kidney patient charities to fund a very ambitious study called the MELODY study. And this study aims to assess the immune response to the 3rd dose of the vaccine in 36,000 patients. I'll say it again, 36,000 patients. Now, 20,000 of those patients will be solid organ transplant recipients, and the majority actually are going to be kidney transplant recipients. But we'll also have patients that have autoimmune disease, that have had immunosuppression, and also there'll be a smaller number of cancer patients that have various cancers. And the idea of this is that we will use the point of care antibody tests that have been used by the REACT study to see whether people in the community are responding to a vaccine or have had COVID. And they're going to send out 36,000 point of care tests to evaluate the immune response to the vaccine after the 3rd dose. And again, this data, it has to be done quickly because the doses are happening right now. But this data is again a hugely valuable to try and identify patients who we think may be vulnerable despite having the 3rd vaccine. And the preliminary thinking before the study was started is that there may be up to 9,000 patients who may still be at risk despite having a 3rd vaccine. So again, a very important study, and that research will be published and brought to the attention of other stakeholders as soon as it's available. Just want to give you a little overview of the charity's future plans and our priorities. And certainly patients were very important in helping us derive our new 2020 to 2030 strategy, and in prioritizing what research needs to happen as a matter of urgency to drive forward an end for kidney disease, which is what we all like. And here you can see the strategy, and you can see we've got a various things like a vision, a purpose, a priority, and spotlight. One of the things that I personally really like about working in the charity is I think there are these core values of ambition and bravery, urgency and passion. And I think they are the things that really exemplify the charity. And indeed, after hearing Andrea speak to you all this morning, I think actually it probably exemplifies the charity that you are working for patient benefit in difficult circumstances. And we identified some urgent areas that need research, because if we don't have research, we can't really affect change over the next decade. And these were transforming treatments, multiple health conditions, and health inequalities. And Lisa has already mentioned health inequalities and how important that is. So why did we focus upon transforming treatments? Well, it's actually what patients and friends, family and carers of patients actually affected by kidney disease told us. They said that's the most important research probably for us, is actually changing the treatment, making it better, making it kinder, making it more effective. So we really want to raise awareness of the realities of what kidney treatments are like. And again, you'll see a video in a moment, but when you speak to a broader audience, people often think that having a transplant is a cure. They may not think that transplants fail, or they think that dialysis is an acceptable form of treatment. And we, through this campaign, we want to change those views, as you do, I'm sure, and inform those who don't know what it's actually like to live with kidney disease. So the Transforming Treatment campaign was launched earlier this year in May, and I think it's had a really huge traction on social media since then. And the aim is to raise an additional £3 million of research over the next 3 years, specifically in the areas of dialysis, transplantation, and medical technology, because I think that's going to have a lot to offer us. And that will then support the transformation of kidney treatments for patients. Now, we are perfectly aware that £3 million is not enough, and therefore we also look at partnerships with other organisations and also alternative ways to try and fund and drive research forward to make the pot larger and to have greater impact. And this campaign is using real people and sharing their particular kidney stories. And the messaging around it is aimed to be straightforward, realistic, again, with a sense of urgency. And you'll see more of our communications and funding activities supporting this campaign coming through in the coming weeks and months. And actually, we're going to have a gala dinner in April of next year, again, to try and raise funds for the campaign. Okay, so we've got a video here. I'm going to share it with you, where you'll hear from Dale, Seema and Ephibria, who are all patients, and also you'll hear from James, who is a clinician from Leicester and a researcher with a big interest in dialysis. Can you play the video, please, Tim?
One of the first things that you're told, or that's explained to you, is there is no cure.
Thank you. Shot one, take one.
Yeah, so I mean, the kidney obviously has got loads of different functions. You know, the kidneys are not as fashionable an organ as the heart, for example, but they play a really important role. But I think what's important to understand is just how common kidney disease is. It's as common as diabetes, and yet it's talked about a lot less.
So my family have been affected by kidney disease quite significantly.
Having kidney disease is my normal. Hospital did definitely become the second time.
I was absolutely petrified. I just landed my dream job working overseas. Everything just came crashing down.
For my dad, being on dialysis I think he was on dialysis for about 4 or 5 years, and it really did affect his life massively.
You'll just put on so much weight, and I think I honestly put on a stone in less than a week. And it was like, it was a very quick and sudden change. I looked different to how I usually did, and it was uncomfortable and I couldn't walk far. And for me, that was the hardest part.
I've been transplanted, and I'm very, very lucky. But I'm under no illusion that I'm fixed. You're living every day with the knowledge in the back of your head that it's a plaster over a problem, you were just desperate for a breakthrough.
The amount of funding that is given to kidney disease is less than many other chronic diseases. That probably means that the research we would like to do sometimes is not prioritised, and that's not because they're not important research questions, and that's not because they're not research questions that actually people with kidney disease would like to see answered. It's just because there isn't enough funding to do that.
I would hope that the whole dialysis process was able to be easier for those individuals that are having to live with it. It's still a significant amount of time that the individual is having to be hooked up to a machine to dialyse. It also limits the ability to travel, to socialise, to do all the other things that really, make up what we want to do in life.
When I started dialysis this time, obviously my parents remember when I was a baby a lot clearer than I do. I think we were all surprised to see that from patient perspective, obviously, that actually not a lot had changed, which in 20 years, I think just shows that funding is so important for kidney research.
I just want to live a normal life. That's the difficult part, is that I know that's not going to happen without further developments in better drugs, better technologies, better research, better understanding. And the only way that that's going to come about is by raising money in order for people like me to continue to live their life.
The research has got to be the key to getting to the right treatments or mechanisms to be able to avoid people having to suffer in the way that we have as a family.
I can tell you that you know someone who has kidney disease or is affected by kidney disease, and that by donating money to Kidney Research UK, you're going to ensure that the access to care they get is going to be better.
It doesn't matter how much you can donate, because every contribution counts towards funding vital, life-saving research.
Thank you, Tim. I think that video just says so much about kidney disease, how it affects people, their families, and actually what's needed to effect change. And that has to be through more research, better research focused upon things that are of key relevance to patients. So it would be great if you could help us spread the word. And again, you could feel free to share that video on your social channels. You can find it on the charity social channels, or it's on the Kidney Research UK YouTube channel. Moving on a bit to patient and public involvement at kidney research. Again, this is obviously fundamental to the charity. Patients are involved at so many levels as advisors, participants, advocates, and it permeates all our strategic actions. And what we must do is work together as a community. And I think that's a really important word for us to make sure that more kidney patients are informed about research and the outcomes of research, have their voices heard in research and developing the priorities for research, and also have the ability to get involved in research. And I think that can be an issue in terms of equity of access to research. Together, we need to drive the agenda to effect change and change health outcomes for individuals who are affected by kidney disease. And again, it's about building that community. We get resilience through being part of a community and encouraging patients to take action, either with their time, their voice, or their money. But again, that is all very important for effecting change. Now, within the charity, we're very lucky that we have Miranda Scanlon, who is, she follows on from Phil Smith as the chair of our newly named Lay Advisory Group. Miranda is a transplant recipient, tremendous energy. And the quote you see there, again, just highlights the fact that, patient involvement is a huge value, but we must ensure that we make that involvement count, because there are difficulties that can get in the way of patients engaging with the work of a charity because of the things that affect them in their lives. So that's a really important thing that we are aware of, that we want to make all input from all patients count. And the Lay Advisory Group is doing really well. I think it's set to become very influential. There are members who are joining external networks. So, for example, Miranda has now joined the MHRA, and is taking a much more active role in all of our discussions, certainly. And I think the aim is to have the creation and optimization of a culture whereby we have a really diverse and inclusive group of patients, and that they have their say in shaping the research that makes a difference to them. And I think under Miranda's stewardship, another great folk that will happen. So a couple of take-home messages for you. So I think kidney research is a research charity, and often people think of that as being lab research, but essentially patients are at the heart of everything we do. COVID has really challenged us, but we've responded. And again, with the help of organisations, including the NKF and the KPAs and other charities, I think we have managed to do something of real value in the space around COVID and kidney patients. And transforming treatments is now this key strategic priority for the immediate future. It's going to run for several years. We need to raise the funds and implement research to try and affect change. And as ever, working with partners is critical. I think we are essentially all about collaboration and working with partners, because that's how we're going to get success now and also in the future. So thank you all very much for listening, and I'm very happy to take any questions you have.
Thank you very much, and what a powerful video, and so true. So we've only got, one subject on many questions, and that's how can you volunteer for these studies? So
that's an important area, and it's something that we are keen to improve, because at the moment, what you can do is you can go to the website for the National Institute of Health Research. You can indicate where you live, and that will tell you all of the studies in renal medicine that are active in your area. And that's fine. You can go, if you live in London, you can actually then get engaged in a study. You can approach people to say, yes, can you tell me more information about your dialysis study or your transplant study or what have you? The issue that we have with that as a charity is the fact that it puts the onus upon the patient to go there and actively look at what's on offer and then choose if they want to be involved. We think that a better system would be if a kidney patient can actually, or a family member, I mean, there's research around families, carers, how kidney disease impacts their wider family. People can go to a website, and we want this to be the NIHR website rather than duplicating effort, and they can then give consent to be contacted. So if researchers think they might be suitable or interested in being involved in a study, they can then actually contact them, and then you would have obviously information, time to consider it, and you can then say yes or no. And that then actually allows, in a way, the the ability or the opportunities to come to the patient. Now, this happens in Scotland, so we have a thing called the share system, whereby I've enrolled, signed up, and actually people can then come and contact me if I could be a control or if I could be involved in a study. It's the same in dementia. There's a website where, as a family member or patient, you can actually get engaged in research, and we want to try and get the NIHR to change their website to allow all patients to be able to just do a one-stop shop, go there and then say, I'm interested in being contacted. Please let me know if there's research in my area. But even now, you can go there and actually find out what studies are occurring in your area.
Brilliant, thank you. Quite a few people have said what a great video, as I touched on earlier. And how can they share this? They've put. I know you mentioned that, didn't you?
Yes. Again, I think it's on the Kidney Research UK YouTube page, so you can share links to that. You'll find a variety of the charity social media will have potentially clips from that video. I agree with that. I think we saw that video in one of our trustees meeting, and literally I think it just gets across, doesn't it, so beautifully and powerfully exactly what the situation is like now. And as Afria said, things haven't changed. And that's got to be something that we must do more about. So again, go to the YouTube page. But again, if you go to the Kidney Research UK on Twitter or other areas, you'll find tweets that you can retweet, etc.
Brilliant. Jeremy, thank you very much for your time. We will have some more people coming up with some great speeches and presentations. Catherine Parker's coming up, renal pharmacist. We've got James Gilbert, consultant transplant and vascular access surgeon at Oxford University Hospitals. But we're going to take a break now. We're going to have a comfort break.